Acute kidney injury is when your kidneys suddenly stop working properly. It can range from minor loss of kidney function to complete kidney failure. AKI normally happens as a complication of another serious illness. It's not the result of a physical blow to the kidneys, as the name might suggest. This type of kidney damage is usually seen in older people who are unwell with other conditions, and the kidneys are also affected. It's essential that AKI is detected early and treated promptly. Without quick treatment, abnormal levels of salts and chemicals can build up in the body, which affects the ability of other organs to work properly. If the kidneys shut down completely, this may require temporary support from a dialysis machine or lead to death.
Welcome to this health channel. Watch the full video to learn more about acute kidney injury.
Acute kidney failure symptoms. You may not have any symptoms of acute kidney failure. Your doctor may discover you have this condition while doing lab tests for another reason. If you do have symptoms, they'll depend on how bad your loss of kidney function is, how quickly you lose kidney function, and the reasons for your kidney failure. Symptoms may include peeing less than normal, swelling in your legs, ankles, and feet, feeling drowsy or very tired, shortness of breath, itching, joint pain, swelling, loss of appetite, confusion, throwing up or feeling like you're going to, chest pain or pressure, muscle twitching, seizures or coma, stomach and back pain, fever, rash, nosebleed. Who's at risk of acute kidney injury? You're more likely to get AKI if you're age 65 or over, you already have a kidney problem, such as chronic kidney disease. You have a long-term disease, such as heart failure, liver disease, or diabetes. You're dehydrated or unable to maintain your fluid intake independently. You have a blockage in your urinary tract. You have a severe infection or sepsis. You're taking certain medicines, including non-steroidal anti-inflammatory drugs, such as ibuprofen, or blood pressure medicines, such as ACE inhibitors or diuretics. Diuretics help the kidneys get rid of extra fluid from the body but may become less helpful when a person is dehydrated or suffering from a severe illness. You're given aminoglycosides, a type of antibiotic that's usually only given in hospital. These medicines are only likely to increase the risk of AKI if you're dehydrated or ill. Causes of acute kidney injury. Most cases of AKI are caused by reduced blood flow to the kidneys, usually in someone who's already unwell with another health condition. This reduced blood flow could be caused by low blood volume after bleeding, excessive vomiting or diarrhea, or severe dehydration. The heart pumping out less blood than normal as a result of heart failure, liver failure, or sepsis. Certain medicines that reduce blood pressure or blood flow to the kidneys, such as ACE inhibitors, certain diuretics, or NSAIDs. AKI can also be caused by a problem with the kidney itself, such as inflammation of the filters in the kidney, the blood vessels, or other structures in the kidney. This may be caused by a reaction to some medicines, infections, or the liquid dye used in some types of X-rays. It may sometimes be the result of a blockage affecting the drainage of the kidneys, such as an enlarged prostate, a tumor in the pelvis, such as an ovarian or bladder tumor, kidney stones. Risk factors. Acute kidney failure almost always occurs in connection with another medical condition or event. Conditions that can increase your risk of acute kidney failure include being hospitalized, especially for a serious condition that requires intensive care, advanced age, blockages in the blood vessels in your arms or legs, diabetes, high blood pressure, heart failure, kidney diseases, liver diseases, certain cancers and their treatments. Complications. Potential complications of acute kidney failure include fluid buildup. Acute kidney failure may lead to a buildup of fluid in your lungs, which can cause shortness of breath. Chest pain. If the lining that covers your heart becomes inflamed, you may experience chest pain. Muscle weakness. When your body's fluids and electrolytes, your body's blood chemistry, are out of balance, muscle weakness can result. Permanent kidney damage. Occasionally, acute kidney failure causes permanent loss of kidney function, or end-stage renal disease. People with end-stage renal disease require either permanent dialysis, a mechanical filtration process used to remove toxins and wastes from the body, or a kidney transplant to survive. Death. Acute kidney failure can lead to loss of kidney function, and, ultimately, death. Prevention. Acute kidney failure is often difficult to predict or prevent, but you may reduce your risk by taking care of your kidneys. Try to pay attention to labels when taking over-the-counter pain medications. Follow the instructions for OTC pain medications, such as aspirin, acetaminophen, ibuprofen, and naproxen sodium. Taking too many of these medications may increase your risk of kidney injury. This is especially true if you have pre-existing kidney disease, diabetes, or high blood pressure. Work with your doctor to manage kidney and other chronic conditions. If you have kidney disease or another condition that increases your risk of acute kidney failure, such as diabetes or high blood pressure, stay on track with treatment goals and follow your doctor's recommendations to manage your condition. Make a healthy lifestyle a priority, be active, eat a sensible, balanced diet, and drink alcohol only in moderation, if at all. Acute kidney failure occurs when your kidneys suddenly become unable to filter waste products from your blood. When your kidneys lose their filtering ability, dangerous levels of waste may accumulate, and your blood's chemical makeup may get out of balance. Acute kidney failure, also called acute renal failure, or acute kidney injury, develops rapidly, usually in less than a few days. Acute kidney failure is most common in people who are already hospitalized, particularly in critically ill people who need intensive care.
Subscribe to our channel to keep up with new content. Your subscription, support, and feedback are much appreciated.